Have you ever witnessed a real heart attack? Well, most people I ask who are not working in hospital will say no. And yet if I ask them, can you describe what a heart attack looks like? They're able to. And why? It's because of what they see on TV shows and movies. In fact, it is good that they over-dramatize the heart attack symptoms so that people recognize this crushing chest pain, bending over, profuse sweating, even fainting. However, those are not always the symptoms of a heart attack. Symptoms of an early heart attack are what we call angina. Let me tell you the three characteristics of angina pain. So the first thing is that it is brought on or precipitated by exertion. So it doesn't get worse when you're resting, it's worse when you are climbing a set of stairs, for example. The second is the nature of the pain. It is not a poking needle-like pain that goes all over the place. It's usually a central or left-sided squeezing or crushing heaviness is what patients will feel. And the third characteristic is that it is relieved by rest. Now, those are typical angina. The thing is, these symptoms can also be what we call atypical. That means that instead of feeling it in the chest, it could be a tingling in the arm. It could be a jaw tightness or a neck tightness. It could even be pains at the back or a sense of pain in the upper stomach area. So all these are atypical equivalents of angina. Both men and women can experience typical symptoms of a heart attack. What are those? That means a central or left-sided crushing chest pain, like an elephant sitting on the chest, and that pain can go down the arm, associated with a lot of sweating and even almost going to black out, that feeling. Both men and women can experience that. Women, though, more often than men, experience atypical symptoms. Now, what are those? What I've seen, neck tightness, jaw tightness. In fact, some people have gone to the dentist thinking that they've got dental problems. It can also be a very non-specific fatigue, which should not be ignored. Many people have said, I thought I had indigestion, even a back pain. All these can be atypical symptoms of a heart attack. It is so important to recognize the early symptoms and signs of a heart attack because we have treatments that can effectively prevent the full-blown heart attack. Remember, the commonest way a heart attack presents is actually dead. And that's because the heart attack happens somewhere out of hospital and there's collapse and there's no way of performing resuscitation to get the patient back. But if you present early, what we can do is give you medications and we can even use procedures to open up the heart artery that is causing the heart attack. I have a lot of case examples from my patients who come in and luckily survive to come into the hospital with a heart attack, who will later tell me that they have experienced warning symptoms in the weeks before, but ignored it. For example, they would say, I thought I had indigestion, and they were giving themselves antacids. Or they would say, I thought I was just getting unfit, so I actually even tried to lose weight and go to the gym. And instead, what should be the response is, this may be an early symptom of a heart attack. I should see a doctor.